Don't let anybody tell you that we can't afford public health care. I mean, we are one of the wealthiest countries in the world, and anybody who tells you that we can't afford healthcare has got an agenda to privatize healthcare. I think one of the things that doesn't really get brought up enough is the cost of regulating a private system, right? Like, do we really want to spend millions and millions of dollars fighting against the people that we're actually giving contracts to provide healthcare to us? As long as we continue to have a publicly funded model, public delivery is the only thing that makes sense. The choices that we have are simple. We could either go the direction of the United States or we could go the direction of Europe, right? And there's actually a variety of different models in Europe. In France, there's healthcare practitioners who will actually come to your home. In places in Italy, there's co-ops that are run that, not only give the provision of healthcare to the local level and make sure that there's healthcare available to people at the local level, but it also keeps the money in the local system, right? So you're not giving your contracts out to a big company that comes in from abroad, but you're actually giving the contract out to local practitioners. So not only is the training done at the local level, but also the provision of care is done by local people. The more that we can take that weight off of the hospitals, the easier it'll be for us to be able to actually reduce wait times for essential procedures that are happening in hospitals. We not only need to take care of our health as individuals, but we need to have healthy ecosystems that we are a part of, right? Part of what creates our health problems is toxins in the atmosphere. It's pollution, right? It's a lack of clean drinking water. It's a lack of healthy food. So, we need to look at a health policy holistically that includes land use, that includes food security, that includes clean air and clean water. That's part of healthcare. Making these changes, shifting to a renewable energy infrastructure and moving to a sustainable green economy, these are the things that will actually reduce our healthcare costs over time. Part of it is labor policy. Part of it is the stress of our working lives. Part of it is our working environments. All of these things are connected to what makes us happy and healthy and truly wealthy. So when we're talking about healthcare policy, or we're talking about energy policy, or we're talking about labor policy, we have to understand that these things are all connected. The Green Party is the only party that isn't a one issue at a time party. We're the only party that looks at policy holistically, and that's why I'm proud to be a member of the Green Party and why I want to be the leader of the Green Party of British Columbia.